Good evening, everyone, and welcome to Spasticity in MS, the latest presentation in the webinar and telelearning series brought to you by Can Do MS and the National Multiple Sclerosis Society. My name is Brian Thompson. I'm a Programs Manager for Can Do MS, and I will be your moderator this evening. For those of you that are new to Can Do MS, we are an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. Through our programs, we empower people to manage their disease and move beyond their MS by adopting active and healthy lifestyle behaviors. Please visit the Can Do MS website, www.mscando.org, to learn more about our programs, both online as well as our nationwide in-person programs. Can Do MS is excited to partner with the National MS Society to bring you 15 webinars in 2016. The mission of the National MS Society is to help people affected by MS live their best lives as they stop MS in its tracks, restore what has been lost, and end MS forever. Explore the Society's programs, services, resources, and connection opportunities at nationalmssociety.org. I'm going to introduce our two presenters who have been with Can Do MS for many years, and tonight they will explore the prevalent and complicated symptom of spasticity. First, I would like to introduce Gail Hartley, who's a nurse practitioner specializing in the care of persons with MS at the Arcadia Neurology Center in Arcadia, California, as well as the Multiple Sclerosis Clinic at Casa Colina Center for Rehabilitation in Pomona, California. Ms. Hartley earned her bachelorette degree and her master's at nursing at UCLA, and in addition to holding certifications from the MS Nursing International Certification Board, she's an active member of the Consortium of MS Centers, the International Organization of MS Nurses, and the Clinical Advisory Committee for the National MS Society Los Angeles chapter. Kathy SanMartino earned her physical therapy degree from the University of Vermont and served as a physical therapist in the New England area from 1984 through 2000 when she moved to sunny Southern California and started working at the Casa Colina Rehab Center in Pomona, where she is currently an outpatient clinical coordinator. Ms. SanMartino also runs the MS Wellness Program for the local National MS Society and directs a wheelchair and seating clinic. And so we are very excited to have Kathy and Gail join us. But first, before we get to their information, we'd like to get just sort of a base understanding of where you're coming from with spasticity. And so very simply, we would like to know, since you've been diagnosed with MS, have you experienced spasticity? And what you can do is click either yes or no and submit. And in just a few seconds here, we'll see the results. And I think this will give us a perspective of just how prevalent this symptom is with our participants here. So the results are coming in, and as you can see, overwhelming, about over 96% of our participants here have experienced something related to spasticity. So I think that's a good place for us to begin. And at this point, I'm going to proudly turn things over to Kathy and Gail.
Hello, I'm Kathy.
Hi, and I'm Gail Hartley. And I'm just really delighted that we are able to provide this program for you tonight. And I'm really amazed at how many people are on the line this evening, as well as how many of you are experiencing this particular symptom. So for those of you who may be new to MS or do not have MS and are listening just to learn more about this condition, MS is an autoimmune disease that causes damage to the cells of the brain and spinal cord. And this can result in demyelination of the nerve cells that results in symptoms that have far-reaching effects and lots of different types of symptoms that patients can experience. But one of the most common symptoms of MS is spasticity. And somewhere between 60 and 90% of patients who have MS will experience that at some point in the disease course. You've certainly proved that that's actually a low estimate, given that we have more than 90% of patients on the call tonight that have experienced this. So that's the focus of our program this evening. Okay. So when we try to define spasticity, we use a lot of different terms for it, and patients sometimes use different terms than healthcare providers might. But basically, we're talking about stiffness or tightness in the muscles, and it can occur in any muscle or muscle group. This is really described as increased tone, so the muscle doesn't have the ability to relax and contract normally. It can be very mild symptom, which is there just once in a while, or it can be severe and present constantly. It changes from day to day, and for every patient it may be different. It can be constant, as I mentioned. There can be intermittent spasms that occur for 1 or 2 seconds and then not recur, or there can be involuntary movements of a limb or your fingers or even your toes can move spontaneously. And as I said, it can affect any muscle group, but it's most commonly experienced in the arms or legs, in particular the hips or the back. Patients also experience it in the neck and shoulders, however, so it really can be anywhere. When we try to describe what actually causes MS, you can see the picture of the brain and the spinal cord there on the right, and the lesions in the brain and spinal cord actually are reflecting demyelinated areas of those nerve cells. And so the normal signals to the muscles from the brain and spinal cord that help to maintain that normal balance between muscle relaxation and contraction are disrupted. So these muscle groups are constantly being activated, and that leads to them being in a constant state of tension or contraction, so they feel tight. The types of signs and symptoms of spasticity that we see when we're doing our neuro exam with you as a patient, we may see increased reflexes in some of your extremities. We may also describe, or you may describe to us, something called clonus, and this is a repeated muscle contraction. Very often patients will experience this based on the position of your foot, for example. If your heel is elevated a little bit and your toe is on the ground, you might find that your knee is bouncing up and down. That's described as clonus. That means that there's increased muscle tone in those muscles of your calf. And that can lead to limited range of motion of the joint. So it's not as easy to move your legs forward and back. They can feel tight or stiff, and it impairs voluntary movement, your ability to move easily and fluidly in space. But it can also cause involuntary movements and muscle spasms. Some of these might be jerking of your limbs, where your leg kicks out when you don't expect it to. We call that an extensor spasm. If your limb bends backwards or your fingers feel like they're curling in, those would be described as flexor spasms. Sometimes the adductors, which are these big muscles in your thighs, can pull inward and tight so that your knees feel like they're locking together. That's an adductor spasm. And if there are spasms in the back, it can actually cause some arching, so it makes it difficult for you to position yourself comfortably while seated. May cause you actually to slide out of your chair a little bit.
Great, and just to get a sense of some of those symptoms and what we're experiencing out there, we have a second polling question, and you can click as many of these 4 common symptoms as relates to you. Just to get a sense of which of those symptoms that we've discussed so far that you have experienced or are experiencing. So go ahead and click as many of those as relate to you, and we'll give it a couple more seconds here. We have a lot of participants and a lot of participation, which is fantastic. We've got almost 600 responses here, and we'll take a look at what we have. And Certainly, the tightness or stiffness of muscles is very prevalent, and then muscle spasms and interference with mobility. In your experience, Gail and Kathy, is this sort of online with what you see out in your practices?
Yes.
Yeah, I would say also, yes. Well, that's
Great.
Great responses there. So the problem with spasticity, the major problem, as we've seen, is that this can limit the range of motion of your arms or legs or other body part, and it limits the normal movement of an extremity. It can interfere with walking. As I mentioned, very often patients will describe that their legs feel heavy, like they can't move them forward easily. It can interfere with your seating position. You may feel stiff if you're sitting in certain positions in your chair. It can limit your ability to transfer easily because you may not be able to straighten your legs as easily as you might otherwise. And that certainly increases the risk for falls. When you're very stiff, you can't move quickly and right yourself if you lose your balance. If the spasticity is not managed well, it can cause contractures, or what we describe as frozen joints. There can be tightness in the knee or an elbow or your fingers, and you really have a very difficult time straightening that joint. Also, you can develop pressure sores if you are not able to relieve pressure by moving easily, and certainly spasticity causes pain, and that is something that we really need to pay attention to. It can disturb your sleep. It can interfere with your activities of daily living. Pain causes more depression. And it's very, very important for you to report that symptom to your healthcare provider so that we can manage that effectively. There are a couple things that can make spasticity much worse, and the most common thing that I see is infection. So sometimes patients will call and say, "Oh, Gail, just in the last 24 hours, my spasticity is so much worse. My legs are so much heavier than they've been." And that person might feel like they're having an exacerbation. But the first thing that goes through my mind is we need to make sure that you don't have a bladder infection or a cold or flu or pneumonia even that could increase the spasticity. We also see that if a person has a full bladder or can't empty their bladder completely, that can increase spasticity as well. Constipation does the same thing. When people are uncomfortable for any of these three reasons, we see more spasticity. There are some few. So tight clothing, a belt that's too tight, anything like that can make spasticity worse. We also see if you're in the wrong position, if you're in a bad position in your chair or in your bed, spasticity can be worse. Even sudden movement, having to turn quickly, can cause muscle spasms, and also heat and humidity. And I'm sure a lot of you this year, in other parts of the country as well as screaming hot California, are experiencing more spasticity when you're out in high temperatures. So those are things that we really have to pay attention to. When you report that, the signs or symptoms of spasticity to me, the first things that go through my mind are a little checklist of what do we need to do to get this under control. And one of the first things, it's kind of out of order here, but one of the first things is to assess for those conditions that may exacerbate spasticity, as I said, like infection or constipation or full bladder. But the other thing, first line, is physical therapy. We really need to use our whole healthcare team to make sure that we've got a multidisciplinary plan for managing this symptom over time. So physical therapy is one of the first things that I'll refer my patients for. And then the other thing is medications. And we'll talk about those a little bit more at the end. But I'm going to turn it over to Kathy now to describe what our options are in terms of physical therapy.
Hi. Thank you, Gail. This is Kathy. So first of all, when we see you in physical therapy, we're going to talk to you about your experience with spasticity because that can be very individual. So one of the questions we'll ask is, in your experience, how does your spasticity assist or interfere with your function? So walking is a really good example of the pros and cons of spasticity. So what we see a lot is that the front of people's thighs, their quads, get really stiff with spasticity. So the knee is very stiff. So when you're walking, that can be helpful in that when you stand on that leg, when you're stepping on it, you know it's not going to buckle underneath you. But by the same token, that same stiffness in the knee can be very difficult and make it laborious to swing that leg through. So there's pros and cons to spasticity, and we need to figure out what your experience is with that. So also, has it caused you injuries? Gail mentioned this as well. So again, for example, if you're walking, if you're having difficulty swinging your leg through, if your calf muscle is stiff or your toes are dragging, that can cause you to fall. People who are in wheelchairs, what I've seen is sometimes they have spasms that can throw them out of the wheelchair or pitch them forward when they're trying to transfer. So we also may ask you, what is the frequency of your spasms? Do you have any pain due to spasticity? And have you figured out any of the triggers that maybe we can address? Objectively, what we're going to do is, first of all, assess your spasticity directly. So what we may do is move your limbs quickly, because spasticity is a sensitivity of your muscles to being stretched and moved. And we'll rate your spasticity on what they call the Ashworth scale, and that's a 1 to 4 scale. 4 being the limb is very stiff and 1 being very minimal spasticity. Then we'll check your flexibility and your range of motion to see if that's getting compromised. And just to digress a little, what I always encourage clients is, just like you see your medical team, your physician and your nurse practitioner on a routine basis to stay on top of your symptoms, I always encourage people, physical therapy-wise, to do the same, because sometimes these changes can evolve slowly to you over time, and so it takes someone who hasn't seen you in a while to say, you know, that's a lot tighter than it used to be. Let's address that. So that's one thing I always recommend. We also will assess your strength, how strong your muscles are, how well you can control them. And when we measure strength, we measure it on a 0 to 5 scale, 0 being no muscle contraction and 5 being normal. Then we'll also look at how you are moving, and so we can kind of put the pieces of the puzzle together in terms of how any weakness issues, flexibility issues, spasticity issues, how those are affecting your mobility. So one thing we'll make note of is, how much assistance do you require when you walk, when you transfer, when you move around in bed? What sort of compensatory movements are you doing? So there's a range of normal ways of rolling in bed, sitting up, walking, transferring, and such. And then we'll see people kind of alter that technique according to spasticity and weakness and tightness. We'll also objectively look at how safe your mobility is, and what sort of techniques you are using to get from point A to point B, and also what equipment are you using, and sometimes we'll kind of start thinking about what equipment will introduce you to see if it'll help make your movement easier. Because we know the more easy a movement is, the less laborious it is, the less stressful it is, the quieter your tone will be while you're doing that. So Gail mentioned some of these. So potential complications of spasticity. One of the big ones is contractures. So you run into this vicious cycle with spasticity and flexibility, that when a muscle gets tight from spasticity, it stays tight, so it's less flexible when you're trying to stretch it and use it. And the tighter a muscle gets, the more stiff and spastic it gets. So like I said, it's a vicious cycle. And the concern is if it gets too severe, then by the time some people get to physical therapy, they're so stiff and their joint is so contracted that there's not a lot I can do, and then that's when we have to suggest maybe surgery to correct that. Thankfully, that's very rare, but that's just a caveat to kind of stay on top of tightness and spasticity, that it's not getting out of control. So spasticity can cause contractures. It can lead to increasing spasticity, which can lead to declining mobility, to pain, skin breakdown, fatigue, and decreasing endurance. So if your muscles are stiff, it makes your movement more laborious. That's going to really increase the fatigue you experience with just trying to get from point A to point B. And also the other big concern is falls and injuries. So in the MS population, a study has shown that in a given year, nearly 60% of individuals with MS will experience a fall. So some of my clients will translate that as, well, yeah, I fall, I have MS. But even though it can be a frequent occurrence in clients with MS, it's still something we want to look at and still something we want to minimize or eliminate the risk of you falling, because certainly you're not always going to bounce, and sometimes you can get unnecessary and serious injuries from it, not to mention losing your confidence over it. Also, over 70% of older people with MS report moderate to extreme balance problems. And just like in physical therapy, we can help with your flexibility and strength, we can also work on your balance with specific exercises addressing that. So spasticity management. So what do we do for treatment in physical therapy? The first thing we'll do is teach stretching exercises. So again, to break into that vicious cycle of your muscles get tighter, they get more spastic, which makes them tighter, etc. Along those lines, we'll also look at positioning. How do you sleep at night? Is it the best position for keeping your muscles relaxed and less spastic? If you're in a wheelchair, how is your positioning in that? Where do you hang out during the day and position yourself? So we can give you advice on ways to try to keep your spasticity quiet. We'll also work on strengthening exercises, especially muscles that oppose the spastic muscles. So for example, again, going back to the example of walking, if you're walking with very stiff legs, your knees are stiff, we'll work on trying to strengthen your hamstring muscles, the back of your thigh, the one that's responsible for bending your knee, to see if we can help it overcome some of that stiffness in the front of your leg. And we'll work on correcting your mobility, or perhaps a different way of putting it is exploring different techniques of mobility. So if you're rolling, for example, can we teach you other ways to make it less laborious and easier so that you're less spastic? Also, we might consider equipment to decrease the difficulty of your mobility, which we know will decrease the fatigue level. And again, if the activity is less stressful and less difficult, then we know your spasticity will be a lot less. And a good example of that is, for example, you probably notice when you're just sitting, when you're laying down, your spasticity isn't quite as ramped up as it might be when you're trying to walk or doing something really difficult. So one of the things we work on is, or one of the take-home messages we give to people is to work harder, work smarter, not harder. So maintaining proper posture and body mechanics can help relax your spasticity. When you're doing an activity, take the opportunity to sit to do the activity whenever possible. Use equipment as needed to avoid reaching, carrying, squatting, again, to make the activity simpler. And also using orthotics, in other words, bracing, or mobility devices as needed to decrease the energy expenditure of walking. So with bracing and mobility devices, one caveat I always say is make sure you're getting properly evaluated for walkers, for braces, for wheelchairs, anything like that. All this equipment, of course, is very pricey, and your insurance company will only really wants to hear from you every 5 years or so about getting the proper equipment. So if for some reason you're not getting the right equipment, you may be kind of stuck. So some examples of assisted devices or mobility devices are a simple cane. What I don't show here is a cane with 4 prongs called a quad cane, forearm crutches, a front-wheeled walker, or four-wheeled walker, which the advantage of the four-wheeled walker, you can see that there's a seat that you can flip down there, so you always have a chair with you when you're out and about walking. So some people are hesitant about going there, about getting assisted devices for fear that they're going to rely too much on it. But this is a quote from an individual with MS who did transition to using more equipment. And she said, "I'd realized how much energy, both mental and physical, I had been using just to maintain my activity without the equipment. How much easier the use of the device made it for me, how much more energy it allowed me to have, how much more independent it allowed me to be, how much better it helped me feel about myself. The other thing I found was that it helped me to see how many things I had stopped doing without even realizing it, but that I could now do again." So that's one of the questions I always ask my clients. Have you gotten to the point where you're starting to choose not to do activities because of the MS symptoms? And if so, let's explore that and see what equipment we can get you so you can get back to those things and make those choices as opposed to letting the MS dictate what you do day to day. So some orthotics bracing devices that are low-tech, in the right-hand side of the screen is a carbon fiber brace called the toe-off brace. Being carbon fiber, it's incredibly lightweight, incredibly thin, so it fits in any shoe. You don't have to get a bigger shoe. And it's really good for people who don't have a lot of tone and who just have that drop foot, that weakness where their toes drag. So it can really help give you more of a spring to your step. For individuals that have a little more spasticity, so we really need to contain that foot so it doesn't get kicked off with each step, we would recommend more of a custom molded AFO, which is in the middle there. It's a plastic brace that's custom molded to you. And it could have a joint or be solid, whatever you need it. And again, it will keep your toes from dragging and keep that spasticity in your calf from getting kicked in. Because sometimes if we control that, then sometimes we find that the spasticity in the rest of your legs quiets down a little. In the upper left-hand corner is a device that was actually created for individuals with MS, and it's called the Hip Flexion Assist Device. And basically you can see there's a belt around her waist which could be hidden under clothes, and then there's a belt that loops through the her shoelaces, and basically there's a bungee cord that goes from the belt around her waist to her feet. And so that bungee cord basically spring loads your leg. So when you step through with the other leg, that bungee cord's in a taut position, and when you pick up the leg with the bungee cord, it now has a spring to it, so it lifts off a lot easier. What we'll find sometimes with patients with MS is that we'll give them a brace for a foot drop, and they're still dragging their foot, but now we realize, oh, it's because they're not lifting up their leg from the hip area. And so that's where that hip flexion assist device can come in. Some orthotics that are high-tech, on the left-hand side is the Bioness, and on the right-hand side is the Walk Aid. So these are two devices that have those cuffs that are around the calf, have electrodes in it that stimulate the muscle that picks up your toes with each step. The Bioness, the device on the left, you can also get the Bioness Plus, which includes a cuff that goes around your thigh to help with your thigh muscles when you're walking. Now, just to be a buzzkill, the one on the left, the Bioness, goes for $6,000, and the one on the right, the Walk Aid, goes for $4,700, which certainly is a far cry from the $1,000 or less that the other bracing goes for. Some private insurances do pay for the Bioness. Medicare, Medicaid, unfortunately, don't. So how to choose what mobility device to use, how to choose what bracing device to use. Basically, what makes you walk more normally? Because when you're walking more normally, we know then it's less laborious, less energy expenditure, less fatigue, less spasticity, and of course decreased risk of falls. Now, a good many physical therapy clinics will have some of these devices for you to try. If that's what you're interested in, you may want to call ahead and see if that particular clinic does. Certainly a clinic in a rehab facility such as mine would have these devices on hand for you to actually try for food for thought for the future or for something to get now. What I always recommend to people is when you get these devices, it doesn't mean you have to use them all the time, obviously. When you wake up in the morning, you think, what am I going to wear? What am I doing today? And what equipment should I have with me? Do I need my walker? Do I need my brace because I'm walking long distance and I just want to make it easier? So those are some of the things I encourage people to do. So to go back to the exercise idea, so when we establish an exercise program for our clients with MS for spasticity management, one of the first things, like I said, we focus on is flexibility, stretching exercises, and then strength training exercises, and then balance and vestibular training. Vestibular refers to our inner ear system that helps us with our balance. And then we also need to incorporate aerobic training, cardio training, so again your fatigue level isn't as low. So stretching exercises, the muscles that we tend to focus on in clients with MS are the hip flexors, the front of the hips, the hip adductors, which are the inner thighs, the quads, which is the front of the thigh, the hamstring, the back of the thigh, and the gastroc, the calf muscles. Yoga is a very good way to do flexibility exercises. There are multiple forms of yoga, some which really focus on the stretching, and that's what's most appropriate for people with MS. It incorporates a lot of relaxation breathing and such that can be very, very helpful and a good part of your routine. Equipment for flexibility exercises, and whenever possible, I try to come up with different ways for a client to do the stretching themselves so they don't have to rely on family or others to help them with this. So sometimes the yoga strap can be helpful to really handle your legs to stretch well, or belts or dog leashes or dog collars or towels. We get creative. Flexibility rules. So first of all, when we talk about flexibility, we really enforce that no bouncing when you're trying to stretch. It can just set off your spasticity. You want to sustain a stretch for 30 to 60 seconds. That way it gives your spasticity a chance to relax and your muscles to respond to the stretch. You want to maintain proper alignment, good posture, so you're really getting the maximal stretch to that muscle. You want to perform your stretching daily to stay on top of it. Relaxed breathing to promote relaxation to that muscle, and to do the stretching slowly so you're not triggering the spasticity. So here are just some examples of some stretches we give. The upper left corner is trunk rotation. Next to in the upper right corner is a good stretch for the hamstrings, the back of the calf. If you also pull your toes up, you're getting the calf muscle. The hamstrings is the back of the thigh. If you pull your toes up, you're also getting the back of the calf. This one laying on the edge of the bed with your leg hanging over, the caveat is if you have a really squishy mattress, that's not going to be a safe thing to do. So just make sure you have someone with you to try it to see if it's safe on your mattress. It can help stretch the inner thigh as well as the front of the thigh muscle as well as the front of the hip. And then here's another one for stretching the calf. Sometimes we'll recommend positioning. So if someone is particularly spastic, we may suggest that you get into positions to hold a minimal stretch for a long period of time. So the upper picture is a good way to stretch your inner thighs. The bottom picture is a good way to position your calves, especially in bed at night, to keep your toes up to keep those calf muscles from getting too tight and spastic. For people who are unable to be more mobile and walk, etc., these are examples of standing tables so that you're really putting your whole body weight down through your legs to relax the spasticity and really stretch out those muscles. However, if you want to work on a standing table, I really recommend you talk about it with your physician because you want to make sure that your bone density is good so that your muscles, your bones won't break under your body weight if you haven't stood in a while. And also you really should go to physical therapy to trial it first because if you haven't stood for a while, the concern is that your blood pressure may drop and it may take a while for you to get used to this activity before you can safely do it at home. Strengthening exercises, we really work on core strengthening, so in general your mobility isn't as difficult. And functional strengthening. So you can exercise each muscle individually, or you can do functional strengthening exercises that work on several muscles at a time. So for example, in this picture, the woman's lunging. So I could have you sit in a chair, kick your leg out to work on your quad strength, or I could have you do a lunging type of activity if that was safe for you to do to work on the strength of your quads, of your buttocks muscles, and work on many muscles at the same time. And that's usually the way I try to go with clients with MS so you don't have such a lengthy exercise program that's fatiguing. Different options too for strength training. If you're able to use weights, there are Velcro weights that you don't have to physically hold on to. You can just put on your wrist or your ankle. There's TheraBand, which is in the bottom picture there, which is a stretchy band that has different amounts of resistance depending on the color. And so that's easy. It tucks away in your house, not in the way. The pool is a really good place to exercise, a cool pool so you don't get overheated. And these are some devices for strengthening your arms in the pool. A cafeteria tray. Sometimes we'll just have people walk in the pool holding a cafeteria tray up in front of them, and that gives them resistance to walking. The bottom picture are weights that are meant to be used in the pool. And you can find all those on Amazon. These are examples of some strengthening exercises we'll give people. And these are examples of exercises specific to specific muscles. Whereas these exercises are more that functional strength training, so doing a functional activity that strengthens multiple muscles at the same time. When we talk about aerobic or cardio exercise, aerobic exercise is defined as an activity that increases your heart rate, involves large muscle groups, and can be sustained for at least 10 minutes. So the Center for Disease Control recommends at least 2.5 hours a week of moderately intense aerobic exercise, and that could be performed in episodes of at least 10 minutes at a time. We've kind of gotten away from monitoring someone's pulse. because some people have difficulty finding their pulse and all that, and depending on your medication, sometimes it's not as effective. So we go more towards the scale of rate of perceived exertion. So when you do an aerobic exercise, how do you perceive how hard you just worked? And for clients with MS, we tend to recommend staying in the moderate range so you're not over-fatiguing yourself. So the take-home message of this slide is no matter your level of impairment, we should be able to find a cardio exercise for you. So for example, the upper picture is an electrical stimulation bike, which will electrically stimulate your muscles of your leg and stimulate them sequentially, so as though you're riding a bike like you would have before. These are other different examples of aerobic cardio, and certainly the pool is another good place for cardio workouts. Rules of exercising with MS: you should be able to recover from fatigue of exercising within 1 to 2 hours after exercising, and if you're not, you may be overdoing it. You have to be careful for your temperature management because that can add to fatigue, and you want to make sure that that your day isn't so busy that you really don't have the energy to exercise. It's not part of your energy budget for the day. Resources: National MS Society and Can Do have wellness programs. MS Society has some DVDs, and some local rehab hospitals, such as mine, will have fitness programs directed towards people with MS. And then this is just advice on how to stay cool while you're exercising if that's a particular challenge for you. And back to Gail.
So thank you, Kathy. So you can see there's lots that can be done in physical therapy, lots of options that you have for managing spasticity and also fatigue and other types of symptoms that go along with spasticity. But sometimes physical therapy alone is not enough, and very often we find that medications in conjunction with your regular stretching program work best. The medications that we have are usually very effective at relaxing these muscles, but also they have some side effects. Many of them cause drowsiness, or if at certain doses may actually make you feel weaker than you would otherwise. They can cause dry mouth or some constipation. So we have to be looking for those particular side effects too, so we can modify the dose to get the best combination for you. And as I mentioned, sometimes we use a combination of medicines. Sometimes one may help, but adding a second one gives us a better result. The dose is highly variable for every single patient. So no matter what medication it is, we have to work closely with you to figure out what the right dose is and what the right combination of medications are. The other thing to consider is the timing of the doses. So if you find that your spasticity is worst in the morning when you first wake up, you may want to take your medicine early rather than waiting until after breakfast so that it's actually working when you're trying to be active. So here are the muscle relaxers that are most commonly used. The first, many of you may be familiar with already, is baclofen. This is an oral medication that is usually taken 3 or 4 times a day because it does wear off a little more quickly. And it may cause drowsiness, or at higher doses it may cause you to feel weak. So those are the things we watch out for. But many patients respond very well to baclofen. If not, we can use tizanidine, which is, again, an oral medication, a pill, that is usually taken about 3 times a day. I often find that this is a good medicine to be taken at closer to bedtime, because it does cause quite a bit of sedation, and it can be very effective in relaxing muscles and preventing muscle spasms that occur spontaneously during the night. Some patients can't tolerate either one of those medicines, and so we may use diazepam, which is Valium. This is usually taken 2 or 3 times a day. It is not just a sedative or anti-anxiety agent, but it is also a muscle relaxer, and it can be effective as well. The other medicine is clonazepam. This is similar to diazepam. This tends to last a little bit longer, so we usually dose it just twice a day. This is another one that I think works very well at bedtime for preventing muscle spasms. We may also use other medications that are considered off-label, meaning they aren't specifically approved for muscle relaxation. Some of the anti-seizure medicines we use are gabapentin is probably the most common one that we see used in an off-label fashion, but it can be very helpful in conjunction with the muscle relaxers as well. Some patients will respond very well to Botox and may be very good candidates for that medication. It is an injectable medicine that blocks neurotransmitters, allowing the skeletal muscles to be more relaxed. It's generally best for smaller muscles and smaller muscle groups of the upper extremities, particularly for patients who have spasms in their hands where their fingers feel like they're curling, feet and ankles also. When we think about using it for larger muscle groups like the hamstrings or gluteus muscles, the dose has to be quite large in order to get an effect, and it's not always as easily obtained for that reason, and also may not be as effective. The medication does wear off and has to be repeated every 3 months. For persons who have spasticity that isn't well managed with oral medications or cannot tolerate high enough doses of the medications because of sedation, we may consider an intrathecal baclofen pump. So this is a programmable pump that's used to deliver much smaller amounts of medications directly into the spinal cord to reduce the spasticity. Generally speaking, this is used for people who have spasms in the lower portion of the back or in the lower extremities. Because it's directly delivered to the spinal cord, it avoids all the sedative effects that the oral doses have. This is, as I said, it's an implantable device. The pump itself is smaller than a can of tuna fish. It's more like a hockey puck, pretty small, and it's inserted under the fat and the abdomen with the catheter tunneling back to the spinal cord. The pump is not implanted immediately. Usually there's a test dose that has to be done first because not every patient will respond to baclofen when it's injected intrathecally. So we do that test dose to see if you're a responder, and if you do, then a baclofen pump is appropriate for you. So it's not for every patient, but it is a good option for people who have very severe spasticity.
Thank you, Gail. So in summary, spasticity, as we've noticed in the polls, is a common and also treatable symptom in multiple sclerosis. Management of spasticity is important for maintaining mobility and function and to prevent the complications. Physical therapy and regular exercise and stretching are very important components in spasticity management. And at times, and very often, we need a combination of exercise and medication to be beneficial in controlling spasticity. And at the end here, we do have some resources listed for some of the equipment that were in some of my slides. And thank you very much. Back to you, Brian.
Well, thank you, Gail and Kathy, so much. Covered a lot of different areas and some really great information. So we appreciate that. And we did receive an overwhelming amount of questions, and so we appreciate everyone's participation and interest in controlling and managing the symptom. We'll try to get to as many questions as we can. If we don't get to your question, at the very end, I'll go over some other ways that you can submit your question to Can Do MS and try to get you as many resources and information as possible. So the first question, and I'm going to try to combine some questions too to get to as many as we can. We got a question about the relationship between diet and MS, if there's any relationship there, and specifically a couple questions about alcohol and spasticity, if there's any relationship there.
Well, I guess I'll start out. This is Gail, and at this point, we don't have any research that tells us for certain that there is a special diet for multiple sclerosis. We can say that we recommend a Mediterranean-style diet, so lower in fats and cholesterol, similar to what the American Heart Association says. The most important thing is achieving a normal body weight, so keeping your weight down, avoiding obesity, which we do know is associated with more progressive MS. There isn't a special diet that manages spasticity. I would say that when in the summer months in particular, it's easy for patients to get dehydrated because often MS patients have urinary urgency and frequency and might limit their fluid intake, and that may actually aggravate some of your other symptoms, including spasticity. So that's something to think about.
And I would also reiterate about keeping your weight down, because that's going to make your movement easier. Easier movement means triggers your spasticity less. Also, it's important to eat well and enough. Sometimes people avoid eating for fear of gaining weight, and so they're not eating as much as they should. And that also is going to affect anyone's ability to move and be real functional.
Excellent. And again, any relationship that you've seen between alcohol intake and spasticity?
Not spasticity specifically. I would say that alcohol intake certainly impairs balance and cognition. So those are the two things that are most concerning. We also have to be very careful if you are taking any medications, any of the muscle relaxers. Those effects can be enhanced if you drink alcohol at the same time. So we have to be very careful about that.
Great. A question that we get more and more here, regardless of the topic, is with medical marijuana and cannabis. If you could talk a little bit about the pros and cons, specifically related to spasticity.
Sure. Kathy, you want to start?
Sure. So the challenge with medical marijuana, there's several challenges. One is that especially if you don't live in a state where medically it's legal, you're going to be hard-pressed knowing what you're getting when you're purchasing marijuana. There are different substances in marijuana. The two main substances are what they call CBD and THC. So when it comes to spasticity, you really want to use marijuana that has a higher content of CBD. But again, unless you live in a state where it's legal and you can go to a established clinic that has knowledgeable people, you really don't know what you're getting, and if you're really getting something that's going to be beneficial. The other challenge is how you consume it. Smoking it, of course, has all the risks of smoking. In fact, they say it's even worse than smoking cigarettes in terms of the toxicity of smoking marijuana. Eating has the delayed effect, so that can be challenging as far as getting the dosage right. Certainly, marijuana today is incredibly more potent than it used to be, so that's the other challenge is getting the dosage right. But if it is something that you want to pursue, you really should be open with your healthcare professional, because like anything else, it is medication. And so really knowing that you're doing it with knowledgeable background of the pros and cons of it. And Gail, if you want to speak to some of the cons and the concerns of how it could exacerbate some of the MS problems.
Well, I think we have to be objective about the use of this particular substance. There is a legal or approved form of marijuana, which is Sativex, which is available in Canada. And there have been some studies that show that marijuana may be beneficial in reducing spasticity for patients. However, many of the studies are very small, and many of them, don't even have control groups. So they're not well-designed studies. That's not to say it doesn't help some patients. I think it certainly does. But again, we have to consider that this is a medication like all others that can have some side effects. So Kathy mentioned already that there's no way to predict the dose depending on how you're ingesting it. And the other effects are the way it may impair balance and coordination, and also it has some long-term effects on cognition. So for people who are using it on a daily basis, multiple times a day, for example, we do find that there are changes in the area of the brain that is responsible for memory. So there can be some long-term cognitive effects. We see this with some prescription medicines also. So I want to be clear that that I'm not saying we should never use it, because I do think there is a role for it. I think we need better information, better studies to actually standardize the dose so we can be more effective in its use. Yeah.
Well, certainly be something to keep an eye on as legalization becomes more prevalent.
Right.
We received a few questions about the relationship between sleep and spasticity. You talked about that a little bit, but if you could just expand a little bit on if lack of sleep can cause or increase spasticity, and any tips as far as particular positions for sleeping that may help, or other tips for kind of controlling or managing spasticity through better and increased sleep.
Well, I think that just in terms of sleep, spasticity can make sleep worse. That's for sure. Whether the converse is true, there's no question when we are not well rested, we don't feel good under any circumstances. But I think that we have to get good control of spasticity so that your sleep is actually a good quality. Kathy, maybe you can talk about positioning.
Sure. So if some of the muscles that tend to get tight in clients with MS usually are positioned in a position of tightness when we sleep. So for example, the calf muscles, when they get really spastic, when we sleep, what our body does is our feet just drop down. So that's where those Prefo boots that were in one of the slides I showed, that can come in handy to keep your ankle at a right angle to keep those calf muscles from getting tight overnight, because that can lead to some early morning spasticity. In general, staying in one position for long periods of time and then transitioning to a different position can set off spasticity. So sometimes, for example, if you tend to lay on your side curled up at night and then you go to lay on your back in the morning, that can really trigger a lot of spasticity, making you a 2x4 temporarily. So that can be a challenge too. But that could be something to kind of explore with a therapist if it's particularly problematic. Are there exercises you should do in bed in the morning before you get out, or are there different positions that could be helpful for you individually?
Great, thank you. We have time for a few more. We also received a lot of questions about restless leg syndrome and restless arm syndrome, and if that's related to spasticity, or if it's different, how do you distinguish between the two and treat either one? So if you could take a little bit about restless leg and arm syndrome in relationship to spasticity.
Sure. So when we talk about restless legs, we focus on restless legs because that's what many people complain of, but it can be restless anything, honestly. These inability to find a comfortable position for your legs, your arms. I've even had patients who said that they just couldn't find the right position for their head at night, and that kept them awake. You know, they couldn't fall asleep because they couldn't find the right position. So we can look at different laboratory studies to make sure that there aren't iron deficiencies or B12 deficiencies or anemias that cause restless legs, and that should be normalized. Even thyroid disorders can cause restlessness as well. So we want to make sure that all those things are corrected. And then we have to try different medications to see what we can do to get control of these movements. Now, some of the movements are definitely spastic, and we need muscle relaxers. But other types of experiences or feelings that patients have about uncomfortable feelings in their legs may be the result of what we describe as restless legs. And there are a completely different group of medication that we use for those, including dopamine agonists and others. So it does take some time to figure that out with your healthcare provider, but it's worth doing, and it can certainly make a big difference in your quality of life, your quality of sleep, and all of that.
And on a similar note, we got a few questions about the MS hug. Could you just talk a little bit about the MS hug and if that's related to spasticity?
Kathy, you want to?
It can be. Well, in terms of, I have had good results showing patients exercises for stretching their back, stretching their trunk. They have had some relief from that.
Mm-hmm. Yeah, and sometimes we do use baclofen for that. Sometimes I mentioned earlier gabapentin, which is an anti-seizure medicine, also used for some painful sensations, and muscle tightness also can be helpful.
And in addition to talking about baclofen, we talked a little bit about Botox, and we had someone just wanted a little more clarification on administering Botox. Is that something that's self-administered, or should you go to your nurse or primary care physician or neurologist, just in terms of the administration?
Botox is usually administered generally for this, not for cosmetic purposes, but for the purposes of spasticity. It's usually, it is injected by a neurologist or pain management specialists also will provide Botox injections.
Great. I think we have time for one more question, and this is a good one for Kathy. We had Elaine asked, she wanted just some tips on locating physical therapists that are knowledgeable about MS and spasticity, and then also her problem is after physical therapy, it lasts for a few hours, and then the symptoms are worse after that, so sort of maintaining it after physical therapy. So it's actually kind of two questions for you. Any tips on seeking out physical therapists that are really specialized in spasticity, and any tips for continuing it after the sessions?
Right. So you'll notice after my name I have several initials. One of them is NCS, which means I'm a neurological certified specialist through the American Physical Therapy Association. So you can go on the American Physical Therapy Association website, and they have an icon for finding a therapist, and it'll ask you if you're looking for someone in a specific specialty. You can put neurology, and it'll show other physical therapists with the NCS designation in your area. It's not an exhaustive list. It's just the therapist who took the time to get their name on the website. The other website is the Consortium of MS Centers. So if you notice, both Gail and I have the initials. I have the initials MSCS, and I think yours is MSCN. So basically we're multiple sclerosis certified specialists through the Consortium of MS Centers. So that will help you find a physical therapist who specifically specializes in MS. You're going to have more luck finding just a general NCS, but certainly they would know quite a bit about spasticity. So the challenge with spasticity is staying up with the recommendations that were given to you by the nurse practitioner, doctor, physical therapist, because it's usually not a quick fix. Sometimes it's not a wow type of fix. Sometimes it's more just struggling to keep the spasticity at bay. So that can be the challenge. As far as the spasticity getting worse after the results wear off, I don't hear that often unless it's related more to fatigue at the end of the day. But that would be a discussion to have with the physical therapist. Say, you know, this was great, but it only lasted so long. So are there other pieces that need to be added to your home program, like maybe bracing or positioning ideas, something additional that you can be doing to help some of the effects last a little longer?
Great, thank you, and thank you, Gail, so much for taking your time and sharing your years of expertise of helping people with MS managing their symptoms and specifically spasticity. We really appreciate this great presentation, and we appreciate everyone for joining us this evening and asking your questions and being active learners. If we didn't get to your question, there are opportunities to gain some education and gain some knowledge. I would highly recommend going to the Can Do MS website, which is www.mscando.org. There you'll find a number of resources. We have an e-news newsletter that we email out once a month with different articles and different information. We also have, it's called the Ask the Can Do team. So you can send in your personal question to Can Do MS, and we'll try to get it answered by one of our many MS care experts throughout the country and send you an answer. So there's certainly an opportunity to get those questions answered there. And then finally, we have a library filled with all of our webinars as well as our library articles, including a great article that Kathy and Gail wrote on spasticity, which includes a lot of what we talked about, but also some of the positive effects of spasticity and other things to consider. And we'll email you a copy of that article along with the slides this evening. And then you can also check out the National MS Society that has a number of great resources, including a video on spasticity management as well as a brochure on controlling spasticity. So you can visit nationalmssociety.org. And finally, I encourage you to continue joining us for our webinar series. It's on the second Tuesday of every month, and we really try to change up the topics and get in MS care experts from across the country. So next month, on August 9th, we'll be talking about anxiety and how exercise can help manage anxiety in MS. So it's called Work Out Your Worries with a physical therapist and a psychologist. And so we certainly encourage you to join us next month and every month free of charge, and continue to be active with Can Do MS. So thank you all for joining us, and thank you, Gail and Kathy. And finally, thank you to our generous sponsors. We couldn't put on these programs without all of you. So thank you all very much, and I hope everyone has a wonderful evening.